A viral tweet is making the rounds after a CDC policy change regarding travel and COVID-19. Brandon Lewis from our Verify team tonight explains how it was taken out of context.
The Centers for Disease Control and Prevention says anyone who tests positive for COVID-19 should not travel on an airplane. This has been its guidance since the pandemic began 2 years ago. But a tweet with more than 6,000 likes claims starting April 7th, the agency began allowing COVID-19 positive passengers to hit the skies. So let's verify. Did the CDC recently change its public COVID-19 domestic air travel guidance? Our sources are the CDC, the Fairfax County, Virginia Health Department, the San Diego County, California Health Department, and the Colorado State Health Department. The tweet claims the CDC would, quote, discontinue applying health travel restrictions to most COVID-19 cases and contacts with reported air travel. This is missing important context. What the tweet is referring to are guidelines for state and local health departments, not the general public. The CDC has not issued any new guidance to the public. Up until April 7th, the health departments we contacted explained the CDC maintained a do not board list for air travel. This was a list of people who both tested positive for COVID-19 and told local contact tracers that they were planning to travel within the quarantine window. Anyone on the list was not allowed to fly to or from an airport in the U.S. Health departments were also required to tell the CDC when someone tested positive after traveling. Starting on April 7th, the CDC told county health officials that it will no longer maintain the do not board list and that departments don't have to report if someone who tests positive is planning to fly or recently flew. However, this does not change the CDC's guidance on who should travel. The agency's website still says anyone who tests positive should isolate and not travel. So, no, the CDC did not change its public COVID-19 domestic air travel guidance. The change only applies to how positive cases are reported by local health departments to the CDC. With your Verify, I'm Brandon Lewis.
Well, if there's something you would like us to verify, you can email verify@12newsnow.com or you can direct message us on social media.